This program is presented by the Centers for Disease Control and Prevention.
Hi, welcome to Beyond the Data, a podcast that gets to the heart of our monthly public health grand rounds and goes beyond the data to give you scientifically accurate, up-to-date, actionable information from CDC and our partners.
I'm your host, Dr. John Iskander with CDC's Office of Science, and joining me today is Dr. Suzanne Gilboa, Senior Scientist at CDC's Infant Outcomes Monitoring, Research, and Prevention Branch. Welcome to the program, Suzanne. Today's Public Health Grand Rounds was about reducing polysubstance use during pregnancy. Polysubstance use is kind of a mouthful. Can you tell us what it is?
Hi, John. I'm happy to. Polysubstance use is the use of more than one substance at the same time, like using alcohol and tobacco or marijuana and opioids. We don't know that much about how polysubstance use affects pregnancy, but we know quite a bit about how each one of these substances individually can have an impact. For example, drinking alcohol during pregnancy can cause miscarriage, stillbirth, and a range of lifelong physical, behavioral, and intellectual disabilities that are known as fetal alcohol spectrum disorders. Tobacco use in pregnancy can cause oral clefts and increases in the risk for preterm birth and low birth weight. And opioid use in pregnancy is associated with birth defects and can cause neonatal abstinence syndrome, or NAS.
So that's very eye-opening. What do we know about how common it is for pregnant women to use multiple substances at once?
We're really only beginning to learn about how common it is. For example, in our study that came out in MMWR on August 6th, we used data from the National Survey on Drug Use and Health to look at pregnant women who drank alcohol during pregnancy, and among them, the use of other substances. We found that the use of other substances was common among pregnant women who reported alcohol use. About 40% reported current use of one or more other substances, most commonly tobacco and marijuana.
What can be done to help pregnant women avoid using these substances?
Screening and intervention by healthcare providers is critical. It's important for healthcare providers to proactively identify those who are at risk rather than wait for them to come seeking care, and that the interventions offered are brief and palatable enough to be acceptable. The U.S. Preventative Services Task Force, or USPSTF, recommends screening for unhealthy alcohol use in primary care settings in adults 18 years or older, including pregnant women, and providing persons engaged in risky or hazardous drinking with brief behavioral counseling interventions to reduce unhealthy alcohol use. The USPSTF also recommends that clinicians ask all pregnant women about tobacco use, advise them to stop using tobacco, and provide behavioral interventions for cessation to pregnant women who use tobacco. And for opioid use disorder, medication-assisted treatment during pregnancy can lead to more favorable outcomes for the mother and for her baby.
So it's certainly encouraging to hear that prevention options are available. What effects does using multiple substances have on infants? What's the outlook for these babies?
Compared to what's known about the effects of use of a single substance during pregnancy on infants, relatively little is known about the effects of combined substances. We do know that the risk of adverse health outcomes, such as preterm birth and low birth weight, is higher for newborns of mothers who use multiple substances than for newborns of mothers who use a single substance. We also know from animal studies that prenatal marijuana exposure can exacerbate the effects of prenatal alcohol exposure on offspring development.
So we also heard in today's session that mothers are often blamed and stigmatized for using substances such as alcohol, tobacco, or opioids during pregnancy. In other fields of public health, combating stigma helps prevention efforts. How can we work to counteract stigma against pregnant women with substance use disorders?
Stigma, blame, and bias can keep people from the best possible care. Women with substance use disorders can often feel judged and blamed by family and friends and healthcare providers, which can keep them from getting the care they need. One of the first steps is recognizing that the stigma is there and it's widespread. The next step is making the commitment to not use words that stigmatize, dehumanize, and are harmful to others, such as using person-first language that puts the person before the diagnosis. Additionally, screening and intervention for substance use for all adults, including pregnant persons, needs to be a routine standard of preventive care, just like cholesterol or blood pressure screening. The more we can make this a standard of medical care, the more it helps to normalize the conversation, improve providers' comfort in discussing these topics with patients, and facilitate shared decision-making between providers and their patients. This further helps to remove stigma.
Broadly speaking, what is CDC doing to address prenatal substance exposure?
CDC's National Center on Birth Defects and Developmental Disabilities, or NCD-DDD, works to prevent substance exposure during pregnancy and its possible effects. NCD-DDD also works to improve care for affected individuals and their families. We do this work through multiple activities. One way we do this is to collect and analyze data on substance exposure during pregnancy. For example, we can look at data from surveys such as the Behavioral Risk Factor Surveillance System or the National Survey on Drug Use and Health to estimate the prevalence of substance use during pregnancy. In the case of the MMWR we recently released, we were able to examine substance use by trimester and to look at the co-occurrence of multiple substances during pregnancy. We also support the implementation of evidence-based interventions. For example, we have projects that are implementing alcohol screening and brief intervention in large systems of care providing women's health services. We've also recently developed clinical decision support tools for alcohol screening and brief intervention to facilitate adoption of this clinical preventive service in primary care settings. These tools are interoperable and can be integrated into various electronic health record systems. We also work with partners such as American College of Obstetricians and Gynecologists, the American Academy of Family Physicians, American Association of Medical Assistants, the National Association of Social Workers, and the American Academy of Pediatrics to promote evidence-based interventions and clinical guidelines to help ensure healthy pregnancies and infant outcomes. Lastly, we conduct a lot of communication activities to increase awareness among various audiences and to share new findings in a timely manner.
And that would certainly include this public health grand rounds. So where can our listeners learn more about pregnancy and multiple substance use?
Listeners can go to our center's homepage at www.cdc.gov/NCBDDD. From there, click the link to Preventing Substance Use During Pregnancy, which directs listeners to more information about these topics.
So as you know, Suzanne, CDC is a data-driven agency. We like to close our segment with CDC's numbers game. What's your number?
My numbers would be 4 out of 10. From our study of polysubstance use among women who drank alcohol, 4 out of 10 pregnant women who drank alcohol in the last 30 days also used another substance, most commonly tobacco or marijuana. That's an important data point to remember because it reminds us that polysubstance use is more common than we may realize. In my final few seconds, I would like to make sure that our listeners know about findtreatment.gov, a resource to help people with a substance use disorder find help.
Thank you, Suzanne. Please join us next time for our Beyond the Data podcast.
Thanks for listening to Beyond the Data. Please join us next time. Be sure to visit the Public Health Grand Rounds website at cdc.gov/grand-rounds and sign up for our mailing list. If you have questions, please email us at grandrounds@cdc.gov.
For the most accurate health information, visit cdc.gov or call 1-800-CDC-INFO.